Hey, everybody, and welcome to our weekly mental health break and chance to re-energize by talking to people who inspire us. Let us know you're here in comments by letting us know what you're drinking, where you're from, where you live, and of course, any questions that you have for this week's guest, who is certainly someone who I've so enjoyed getting to know recently and that absolutely inspires me. Deborah Bosner is the founder of what has now become the very famous across Ohio, the Dr. Amy Acton Fan Club. It now has almost 135,000 members in it. Keep in mind, this didn't even exist a few months ago. And Deborah is a mom who lives in Upper Arlington, which is a suburb, of course, of Columbus. And she's had a really interesting career, which included time in DC, something that we have in common, where she worked for her congressman. Since coming back to Ohio, she worked at Battelle for 12 years. And now she runs a small business in Upper Arlington with her husband. So it is truly my pleasure to welcome Deborah Acton. I almost called you Deborah Acton. Welcome, Deborah Bosner.
I don't have a sister, but if I did, I would choose Dr. Acton.
Oh, she'd be the best sister. No offense to my sister, who is also amazing.
For sure.
That is
She'd be an amazing sister.
She would. Welcome, Deborah Bosner, who you founded the Dr. Amy Acton Fan Club, which I have been a member of. You know, I think I was in that first tranche of several tens of thousands of people. It might have been around 30 or 40,000 there. But I want you to share the backstory with everyone of how did this come to be? Were you just hanging out late one night and went for it?
Kind of. It was sort of, I think, in the works for months and then just happened in a couple of seconds. So I had been watching the news coming out of China for several months, having a small business and, being interested in global affairs, was watching the CDC page, watching the WHO, and just getting kind of more and more concerned and more anxious, worried about my work family. My team is so phenomenal and, worried about what's going to happen. There was so much unknown and so much ambiguity. And I remember, people were just slowly awakening, right, to the fact that it was coming and it was coming in our direction. And I so clearly remember the first time I heard her speak, like maybe March 9th or 10th or something like that. And, she was so focused on the science and the communication and the compassion. And, I just had this this real idea that I was watching like Ohio history or something like that. It was like, she is everything that we need this month. And she's the right person in the right place at the right time. And I just started posting about it on social media. I'm kind of vocal about my beliefs in the social media world. And I was posting links to the Ohio channel and I was vocally declaring Governor DeWine my commander in chief. And, I was just trying to share, watch Amy Acton. Everybody needs to be listening to her. Everybody needs to be paying attention. And one of my oldest and dearest friends, who actually is a moderator of the club now, Beth Allman, that you always have that friend that, kind of goads you and teases you, but in like the lovingness way, was like, Deborah, you really need to start a fan club, because I think I had just posted so much. And like in that moment that she said it, it was just like, this is exactly what needs to happen. This woman needs all the support in the world that we can give her because her job is so hard right now.
You were prescient in that regard, I will say.
Yeah. I mean, I was just how is she doing this? We need to support her and we need to support each other. And I just had this kind of like instant concept that like, this needed to be a thing that everybody embraced. And, we've got celebrities for so many things. And I was like, we need a public health director who's a celebrity because she's kicking butt and taking names. And, it was both just the reality of the situation, the facts, the accuracy, sharing what she knew, but also the openness of saying, this is what we don't know, and this is what we can't control. And, I walked away from that first week going, okay, standing a little bit straighter, shoulders back. If Amy Acton can do this for 11 million Ohioans, I can do this for my 25 staff. And this is what we're all called to do, and giddy up, we are doing this. And so that's kind of, how it started, was just that kind of split moment, but also this kind of idea that I think one of my skill sets is kind of bringing together people of different perspectives focused on principles. And it was just really easy to describe what her principles were, what she stood for, and say, okay, that's what this group is all about. Those principles.
You clearly tapped into something in terms of, obviously people started joining it. I can't even imagine what it was like to see just those numbers flying. What was that like you just clearly tapped into a feeling that people were having this, such uncertainty, and having Amy Acton come through, and it was brutal honesty. We knew she was being honest with us about both what she knew and what she didn't know. And she brought expertise, and she brought vulnerability. And we all felt that. And I think she connected with us, and it built our trust. And we needed that so much, and continue to.
Absolutely. You could just feel the leadership. You could just, and I'm someone that, I went to school and I love to study leadership, and I love to read books about leadership, and just her whole being was she is a rock star, and she doesn't, have formal training in it. It's just sort of an outgrowth of her being a physician and communication, and I think her life experiences, and she was just a natural.
I think her life experience has got to have so much to do with it. Growing up poor in Youngstown, child abuse when she was young, making it through that by the end of her journey in her youth, of course, becoming homecoming queen in high school after coming out from such a tough upbringing, but having that lived experience, I think that's got to just increase your empathy level, right? Of just knowing what it's like to walk in someone else's shoes. And I think we see
that. Absolutely.
Okay. So what was that like to see? I mean, what was it like on day one? Was there
so it was, we really didn't ever, promote the club. In the first day, it was just people, Googling Amy Acton, and our club was the one that returned, results. So we had 80 people, and then it was really exponential growth, kind of like the virus. I mean, it was sort of surreal. You're watching these virus numbers going up, and then it's 80, 200 people, 400, 1,000, 2,000, 8,000. And, by the end of the first week, I feel like it was around 16,000. And then by the end of that second week, it was 80,000.
Wow.
And it was insane. So, I just started, very early on, within the first 2 or 3 days, people that found the page and started commenting, and I was loving what they were saying. I was like, do you want to be a moderator? So I just started drafting people. Some people I didn't know at all. Some people that I had known for a long time. So Shonda Thompson and Sean Kapp and Melissa Klosterman Lando, Jen Johnson, Beth Allman, really early on, they just dove in, and they were like, yep, let's get these principles. And, I would kind of throw them out. We had a little chat board, and I would say, okay, do we all agree with this? And they'd say, yep, on board with that. And we'd post that as a rule. And, we really wanted it to be very strongly about principles. We didn't want it to be a divisive place. It couldn't be. It had to be about how are we all going to get through this together. And
that does seem to be the theme, just the unifying in this moment, as Ohioans.
Right.
And I was curious, actually, your perspective on how, of course, now there was such a feeling of all in this together. And I still feel that in our state. But it's been there's some tension around that now, of course.
Mhm.
And, I got to say, I didn't anticipate, wearing face masks when that became the recommendation by the CDC, and Amy Acton, of course, and DeWine were following that recommendation and have been faithfully. I didn't foresee face masks becoming a divisive partisan issue. This is a public health science-based recommendation where people are figuring this out and responding to new information as we got it. And, but within the club, it seems like this was not, of course, this wasn't a partisan thing. And I think even as it's come under that strain, people have found ways creatively to advocate for this that, get beyond partisan politics, because that's not, it was amazing to me that, on the House floor of the Ohio legislature, there was a vote on whether or not to require masks in the state house to protect one another and, young staffers there. And it was a party line vote. Every single Republican legislator voted against requiring face masks. What is the club's reaction to that been, and how do you keep it a unifying space in light of that?
So I have to say we've, stuck really strongly to the principles and it being a nonpartisan space. And so that has required, some deleting of comments, if they're not following rules, and some removal of members. And, people can say, okay, is that censorship? Is that not? And, but we kind of said, what, this is what this space is intentional about. And if you don't, feel that way, that's the way it's going to be. But I didn't see, at least among the club members, such a partisan, divide. There were lots and lots and lots of Republicans, on the page who, were able to be nuanced, in their beliefs, and were like, of course, I'm going to do this because, it's the right thing to do, or because I want to protect, my fellow neighbors, or, what have you. So there were, a person here and there but it wasn't a partisan issue, on the club. And
Well, I think the club better represents Ohio than what happened on the floor of the state house in that regard. In terms of the unity around doing the right thing to protect each other, versus this being made into, we're going to make this a partisan issue, defy this on partisan lines.
Right. So what I came away with the feeling was that, Ohioans are, really well-intentioned, loving, good people who want to do the right thing, and, want to be reasonable, and, want to follow good recommendations, and want to protect their fellow Ohioans. That's what I came away with.
Yeah. Now, and what's particularly amazing about that is, Michelle, I appreciate that comment. It makes me sad too, how a public health issue has become partisan. It shouldn't be political. It absolutely should not. But the reality is, and I think something that is so inspiring to me about everything you just said about the club, is that this is a time where we are all, as individuals, as our families, people are under a lot of strain for a lot of different reasons, whether, worried about elderly parents, essential workers, who have to be going to work and who are unsure about how safe it is in various circumstances, just the pure financial strain and the job losses. And everyone has had to sacrifice so much. And you and I have talked about this a little bit, and it really strikes me how the pandemic could be changing the ways in which we relate to people who are outside of our own experiences, because for the first time we have a shared experience as a nation, as globally, we are all impacted by this. And I just wonder, how have you seen that spill over that interconnectedness, how have you seen that spill over into how we all are taking in the world, possibly in new ways in this world in which we are so connected?
Right, absolutely. And, early on, Dr. Acton said something about, we're not shutting down, we're waking up, right? And that
Favorite
was
quote.
that was one of her very early comments. And, just like you said, so many people, and perhaps many people who haven't been through anything like this before were really broken open by this whole experience, and it was extremely difficult, extremely challenging. And you touched on Dr. Acton's lived experience, growing up, and I think when you've had a tremendous amount of difficulty and stress and trauma, it does change your entire perspective on things and allows you to look at things a lot more differently. There were so many stories that were shared on the Dr. Acton Fan Club page that, whether they were suburban people or people who lived in the city or people who worked at the state and federal jails, or whether they were people that were first responders, everybody was sharing, the ways that the pandemic was affecting them. And there really was so much empathy being shared. And I guess I would also say, and I don't think that this is a stretch whatsoever. What happened in Minnesota this week, and what has happened to the African American community for so long, in the United States. Like I said, I'm someone who's pretty vocal about my feelings and beliefs, and I do like to get involved in things. But what I've seen differently this week, and I don't think it's just like, the repeated injustices, right? I think it's different now because of the pandemic. I'm seeing so many more people in my social network, right, who are saying things for the very first time about injustice, or about the fact that, they're starting with the disclaimer, I don't like to talk about this type of stuff, or I never am very vocal about this, or I have to say something because this is just wrong. And from my perspective, I'm seeing it much more broadly than I've ever seen it before. And I think that there is a big part of the pandemic that is driving that empathy and understanding, because when people are broken open, it changes your perspective of the world, and you understand that we all are in it together. So I do like to take some hope from that.
Yeah, Deborah, thank you for bringing that up. George Floyd's death has, I think, impacted so many of us. Really, I don't see how it couldn't impact everyone. But I think what you're saying rings so true for me, and I do find it to be a source of hope in the midst of this horribly dark thing that has happened to him.
And I think people are, finding that they need to, the discomfort that we feel as people, and, how hard life is and how challenging it is. A lot of the facades, I think, were kind of peeled away by the pandemic. We saw so many people working out of their homes, and, we saw...
We're all a mess.
Yeah, we're all a mess. Everyone was a mess. And, I think there's an aspect of that, everybody had an opportunity to go, well, what's real? What's important? My relationships.
Yes.
My
no
community.
More BS. What really matters in my life. Yes.
Right. And I think
in the lives of others,
essential workers differently. People, sort of went, oh my gosh, like I'm lucky because I can, send my husband to the grocery once every 10 days, but these people are there every day, being exposed to who knows on all of our behalf. And I think people have just came away with a very different perspective of the world and the sacrifices that other people were making for them.
Well, I really hope that you're right, and that Dr. Amy's quote about us waking up, as a state and hopefully as a country, it is borne out. You know, this is on us. We can't sleep through this. And I think you're right about the vulnerability that happens when we're broken open. And you know, this has been such a difficult time, but we have to look for the growth. Yeah.
Yes. Yeah. And, you know, I just to piggyback on that, like we always need to be growing and learning about other people and learning to be more effective at communicating and, you know, all of that. But I don't know. I'm very, very optimistic, but it's going to require a lot of people having very difficult, uncomfortable conversations.
You got to go there.
We have to keep having those conversations.
Yeah, there's no growth without that discomfort, you know, without courage and bravery to take that on. So thank you for saying that. Deborah, one of our viewers say that you're a wonderful human, and thank you for sharing. I think that too, Deborah. And please, everyone watching, we love your comments. They're so beautiful. Thank you. And Deborah, I can't wait for you to get to see them all later. But also, if you all have questions, please feel free to chime in with those too. I could talk to Deborah for many hours, but I want everyone else to be able to get in on this wonderful conversation too. So, you know, I had asked you actually if you could share with me earlier today what the top posts of all time in this 135,000 member Amy Acton Fan Club were. And I just thought they were really beautiful for what their words and what they stood for. Beverly, can we show that number one top post about standing with Dr. Acton? So this says, we stand with Dr. Acton at home, where she told us to be. Please just write your name in the comments so she can see how many support her event protesters. So I assume this was at the moment where there had been some, you know, armed protesters showing up outside of Dr. Amy's
her
house
home in Bexley.
Yep, not far from where you are, on another side of, you know, Columbus. And, you know, I think a lot of us I remember texting with a friend just being like, if it wasn't for the stay-home order, we would be in our cars driving there right now. And, you know, it just hit us really hard. And it is not surprising to me, but I think inspiring that was one of the top posts. Just, I mean, you know, tens of thousands of people weighing in saying, I'm here, I support you. What was that like to see that skyrocket?
You know, absolutely. You say you were talking with a friend. I was talking with my friend Beth, and you know, we had a little bit of wine that night when we had heard about it.
Cheers. Part of the pandemic. You got to get through it.
And so we were Marco Poloing back and forth, and I think there was a moment there where we were going to, if we weren't against drunk driving, we were going to get in our cars and, you know, drive over there. And, you know, I don't know what we were going to do against people with, you know, assault rifles, but that's what we were ready to do. So and you know, like the page has had so many fabulous posts. I mean, we asked for video memes. You know, I loved cattening the curve. Because, you know, trying to make it a little bit easier for people to understand. And
little kids dressing up as Dr.
Kids dressing up. I mean, there was the videos, and there was the people making masks and masks and masks and masks and masks.
Those are some of my favorite Facebook groups too. All the ones committed to sewing the masks. Yeah.
So, but I was glad that the biggest posts of, you know, all time were, you know, the ones in support of her. And, you know, she does have people who lurk on the page, and, you know, she doesn't, but I know that they share with her the support of the group. And, you know, that was a really important aspect of this. So
I have heard that too. I have heard that I've seen the post actually where even her brother has weighed in. This is a post that was, I think this is the second most popular post of all time in the club. We're talking about, this is posted by a friend of Dr. Amy's. So she's my friend. She's kind and thoughtful, extremely compassionate. Makes me so angry to see her attacked, that she wants to do good. Her soul is so lovely. There are no ulterior motives. It's a beautiful post. And to have, that must be so affirming to, you know.
Thousands of people agree.
Yeah, that's powerful.
Yeah.
Okay, we're going to play a game. This is what we do on Decanted Live.
Okay.
All right, eye roll of the week. Bev, can you cue it up? All right, Tina Fey always introduces that for us, Deborah.
I love Tina Fey.
All right, so we do this on every Decanted Live. You nominate someone, I nominate someone who is deserving, and we are going to ask the audience to vote. So everybody get ready to vote in comments for who deserves the eye roll of the week. Deborah, do you want to go first? Do you want me to go first?
You go first.
Okay. I am nominating someone who has been nominated repeatedly now. Representative Nino Vitale. He is a representative. There he is in the Ohio State House. He has earned eye roll of the week in the past, and I think he deserves it again. This week, there's a lot of reasons, but I'm going to name my top two. This week, he put forward legislation in the Ohio State House to put politicians in charge of deciding who should and shouldn't wear face masks rather than the state health department. So again, trying to say, oh, that Dr. Amy Acton, we can't have her and her public health and science telling us what to do about face masks. We should be in charge. We, who include no physicians, to make those decisions, or scientists or anything. So that was one reason. But then the other reason he deserves it is that he's just like off the reservation now. He claimed that a bill introduced by a fellow legislator, not surprising to me, who is a woman, Stephanie House, up here in Northeast Ohio. She put forward a piece of legislation to prevent gun violence by providing therapy and family support to at-risk youth. And it would give Dr. Amy the power, he claims, so it basically is asking the health department to set up this program, a pilot program in the Cleveland area where I am, to support at-risk youth. And he is claiming that this is a bill trying to get Dr. Amy the power to take away our guns. Keep in mind, this is a gun violence prevention program, all right? And keep in mind that the woman who has proposed this piece of legislation, she's actually a gun owner herself, and the bill actually says nothing about taking away anybody's guns. However, but please do not take my word for that. My reading of the bill, that it doesn't say that. Vitale's ally in this, the Buckeye Firearms Association, acknowledged that nothing in the bill's text talks about taking guns from people. But yet, here's Vitale, and his quote is, "I will give them control of my gun when they pry it from my cold, dead hand." So, very misleading, lots of misinformation there. And I just have, you're my eye roll of the week. Once again, Nino Vitale. Deborah, top that.
It's a tough one. I mean, he really is at the top of the list of the eye roll of the week. Like, you go, oh my Lord, what planet is the man on?
Right.
But my recommendation would be also one of our representatives in the State House, Representative John Cross, up from the Kent area. So, his two of the things that he said this week that I was like, oh my Lord. First of all, there was a kind of a threat, I guess, to the Capitol, police, saying, I'm 6'4", 290, and I won't be pushed around. And, you're like, what does how big you are and how strong you are have anything to do with, your decorum?
He's a man.
I don't know. And then he also kind of has gone on tirades that he's going to fight like hell to not let Governor DeWine, Dr. Amy Acton, hurt small businesses. And he said this multiple times. And as a small business owner, it makes me so angry, because not once during this entire time as a small business owner have I ever felt that they were not on my side and on the side of everyone in Ohio. Not once. The decisions they were making weren't to stick it to me or, against small business owners. They were to protect everyone. And as a small business owner, as we looked to reopen, as we looked to bring people back in the office, we looked to DeWine and Acton and Houston to tell us the right way to do it. So I'm nothing but grateful as a small business owner to our state government. And, you know, he continues to say, you know, step down. He's one of the, you know, top people who wants Acton out of there. And, you know, it makes me furious as a small business owner that he's invoking me in his efforts, because it couldn't be farther from the truth. I'm grateful to our state government for what they've done for small business
absolutely.
throughout the pandemic.
Okay, very well done nomination. One of our, I think Hannah just commented saying that this is a very hard decision. So that means we have done our job well, Deborah. So everybody, we're actually over time here. This conversation has been so great. So we're going to have to sadly wrap this up, but everybody get your votes in. I know some people have already been voting. Beverly's going to let me know who wins for eye roll of the week, you know, this time. But one thing I wanted to ask you about too, Deborah, just as we wait for the votes to come in, and we'll wrap up on this, is that, you know, something we talk a lot about at Red, White, and Blue is, you know, sense of community, this sisterhood of women across Ohio coming together to do great things. And I just have been curious. You said that some of the moderators you didn't even know before. I know that many women who have become involved, you know, in the last few years, who have become a part of Red, White, and Blue, engaged in their communities and in the state, they say that they have made these friends, lifelong friends, people they didn't know just a few years ago, but now are some of their best friends. And I just wonder if you've experienced that at all with your experience, you know, with the fan club.
Absolutely, on a couple of different levels. First of all, you know, I've had some, you know, recognition that I didn't have before with people who I'd seen their names on other community posts, right? But didn't know them. And then because of Amy Acton, they sort of went, oh, I recognize this. And we made the connection. So other people in my local and central Ohio community that we had like maybe just loose connections before have sort of connected more over this. And then I also have to say, I'm just deeply, deeply appreciative of my other moderators and most, especially Sean Kapp and Shonda Thompson, who I had never met before, and just threw themselves wholeheartedly into this endeavor. And there were some really tiresome long days, you know, sometimes 12, 14 hours we were on approving things, deleting things, keeping, you know, the trolls away. And so I just really appreciate everybody's help in keeping the site, you know, going, because I think it has been a big source of hope for people.
Total labor of love and a total source of hope. Okay, Deborah, what I'm hearing from Beverly is that this has never happened before, but it's a tie. It is a tie.
They're both horrible.
Yes, exactly. Just as Julie puts it here.
Yep, Julie, right.
Yeah, Julie's right. So that's never happened before. I usually put up a graphic for the winner, but Beverly probably doesn't have a graphic for that because it's a tie. It hasn't happened. Anyway, so what I am actually going to do is instead declare you the winner, not of eye roll of the week, but, you know, the hero of the night for sure, and for sharing your wisdom and insight with us, and based on what you've learned, and, you know, as a small business owner, as a mom, as a suburban woman, we're just so grateful for what you've done, and please keep it up. Everyone who's watching, if you're not a member of the Dr. Amy Acton Fan Club already, go do that right now. Red, White, and Blue also has a private Facebook group. It's actually the same name as this show, Red, White, and Blue Decanted. So if you're vibing with what we're doing here tonight, check that out too. But cheers to you, Deborah. Thanks so much for doing this. And
it's been a pleasure getting to know you, Katie. It really has.
All right, just the beginning.
Thanks.
Bye.
Good night.